I'm Dr. Maxine Jochelson. I'm the Director of Radiology at the Evelyn Lauder Breast and Imaging Center at Memorial Sloan Kettering Cancer Center. I'm a professor of radiology here, and I do primarily breast imaging with a little bit of PET-CT. I think we have so much technology and it doesn't always get explained clearly. So, you know what a regular mammogram it is. We usually do 2 views of each breast, and we read the mammogram, and mammography is a very good tool for finding breast cancer, but it's imperfect because you're taking an entire 3-dimensional object and putting it into 2 dimensions. So tomosynthesis is essentially like a CAT scan of the breast. The machine takes slices through the breast at 1 millimeter intervals, very thin slices. And so each little piece of your breast is imaged separately. And so tiny things that may be hidden within your breast tissue can be seen. And this is particularly helpful in women who have denser breasts, where there is a lot of white, a lot of soft tissue, and it's hard to see through it. So the advantages of tomosynthesis is that it peels away the overlying tissue and then just gives you a little slice of the breast. That makes lesions easier to detect. You can see the margins of the lesions better than on a regular mammogram. So that helps you decide if the lesion is suspicious or is benign looking. Sometimes you see something on a mammogram that you think is a mass, and when you do the tomosynthesis, you see that this is just a bunch of normal tissue on top of itself. And you can localize the lesion better when you have to go biopsy it. So these things in total improve the sensitivity or improve the number of cancers that are there that you can find, and can also better characterize those cancers to see if you need to pursue them with biopsy or if you can just call them benign. If you're having screening mammography, there is a lot of stress associated with getting that call saying you have to come back because we found something on your mammogram. We have learned that if you do tomosynthesis instead of a regular mammogram, that we need to call back fewer women because we can answer that question on the study that we have already done. Now, there have been multiple studies looking at how frequently we find additional cancers in the breast by doing tomosynthesis when compared to mammography. And this is just one of the many studies. They all show almost the same thing. This was 12,000 women in Oslo, and they demonstrated that using tomosynthesis in addition to mammography, you find 8 cancers in 1,000 women compared to 6 in 1,000 women with mammography alone. So you're finding an additional 2 in every 1,000 women. Additionally, there is a significant decrease in false positives using tomosynthesis. And by false positives, I'm saying something looks like a mass or looks like a cancer, and you either bring the patient back or you do a biopsy and get benign results. The other thing that was very interesting when we first started looking at this is the cancers that we find with tomosynthesis are more likely to be invasive cancers than ductal carcinoma in situ. So the more meaningful, important cancers are being detected earlier. So I'm going to show you a few examples because a picture is worth 1,000 words. So this is a first mammogram on a young woman. She's about 40 years old, and her sister, who is also in her 40s, was just diagnosed with breast cancer. And if you're reading this mammogram quickly, you are going to call it normal most of the time. Now, I will tell you that there is a little something here, but it's something that's very hard to see. So this woman did have tomosynthesis. So you have the regular mammogram and the tomo. And now I want you to pay attention to this area right here. I'm going to show you. I'm going to show you that again. So you're going through this normal tissue, and then all of a sudden, look at this. This is a star. It's a spiculated lesion that is hiding within this breast tissue that is so much easier to see when you are cutting through it 1 millimeter at a time than if you're looking at it here on the mammogram. While I had mentioned that tomo is great in women with dense breasts, even in women who don't have dense breasts, it can sometimes find something we can't see. So this woman's breast is pretty fatty, and generally we can find cancers in this kind of a breast, but here's her regular mammogram. And you don't really see anything that suspicious, but look at this. Here is a mass, and again, you get these little arms extending from the mass. These are called spiculations, and when we see these, we know that there is a cancer there, and we would have missed this on the regular mammogram. Now, sometimes you can see a little something on the mammogram that you know something is there, and then you would bring the patient back, you come back, get some additional views. But with the tomo, you don't need to do that because we found that right away. Now, the specificity part of the reduced callbacks is just as, or maybe even more important, because one of the criticisms of mammography is that causes anxiety when we call patients back. So here is a nice example of a woman who had a little something in the lower part of her breast, and we called her back, and she had multiple additional views. So we have the MLO view, then there's an LLM view, and then we pressed it, and there was still something there, still not sure what it was. And here we have some additional views. This lady got a ton of additional imaging. And then she had her tomo. And this is just an image of one slice, but what you can see is that this is actually a blood vessel, a normal blood vessel in the breast that looked like a tumor. The good news is that we found this with tomo and not biopsy, because one of the things we prefer not to do is to biopsy a blood vessel. Here is another example. This woman has pretty dense breasts, and on her mammogram, you can see something that looks like a mass in the outer part of her breast. Additional views, you can still see it. And now, with that wonderful tomo, keep your eyes open here. And this turns out just to be normal breast tissue that forms, looks like a mass because everything is on top of it. So when we do this, this woman doesn't get called back. She doesn't get any additional views. She gets a letter saying no evidence for cancer, come back next year. There is one caveat. Well, there are a couple caveats. In women who have extremely dense breasts, where there is almost no fat in the breast, tomosynthesis is not better than a regular mammogram, because you need that fat to show you the lesion that's sitting there within the breast. And so the group from Korea demonstrated that this is not a great study for women with extremely dense breasts. And that being said, tomosynthesis is better than a regular mammogram, but it is still not as good as doing an MRI or a contrast mammo. And in fact, recently, one of my colleagues demonstrated that comparing tomosynthesis to what's called abbreviated MRI, a short MRI, shows that the MRI showed twice as many cancers. So, or 150% of the cancers as tomosynthesis. So tomo is what we call a better mammogram. It's a very good way of screening large populations of women. And I think that it has and will overtake regular mammography for screening everywhere in the United States eventually. These machines cost a little bit of extra money, so it takes some time to replace what you have, but it is definitely the way we will be screening women going forward.